One of the ways of preventing HIV/AIDS and also living a quality HIV positive life is by knowing your status. And in this video, we are going to talk about the common types of tests for HIV and how they are done briefly. Keep note that before an HIV test is done on an individual, a health worker must consent the patient. That's to say, a patient must accept to do the HIV test and sign that has accepted. 2, pre-counseling before an HIV test should be done. And also, post-test counseling, after the results have come out, should also be done by the health worker. That lies for 99% of the clients. However, there are certain groups of people whereby a consent will not be required for an HIV test to be done. For example, in case the patient is severely ill on ward, is unconscious, and his situation is worsening, the management team, that's the health workers, the doctor, the nurse, or any other people amongst the medical team have a right to carry out a test on the patient without their consent. That's to help identify the cell status and also improve the management plan. 2, clients who come to get medical services from public services, especially special grade clients, for example, pregnant mothers, those ones have to undergo a routine HIV testing. Why? Because they are risky patients for getting HIV. This means, in case, in such a scenario, if the husband was HIV positive, or if the person who impregnated the mother was HIV positive, and the mother was unaware, it means the mother might get HIV infected unknowingly. And therefore, all mothers, pregnant mothers, have to undergo a routine HIV screening in order to identify their HIV status. And if they are positive, they are instantly initiated on treatment in order to prevent transmission of HIV to the unborn baby. And the common types of tests in Uganda we have include So concerning the tests, I'll categorize them into 3 categories or 3 groups. Number 1, we have the HIV self-tests. For example, this one, it is called Oloquick. It's an HIV self-test, meaning you, the individual, you can buy this from a pharmacy and follow the steps. This is an Oloquick, meaning you take the sample, is in the mouth. You put it in the mouth for some time. After, it has a buffer. It has this. You follow the steps until when a diagnosis of HIV, until when a result is given. That's either negative or positive. But however, note, the Oloquick is just a basic test. It does not confirm you being HIV positive. Therefore, if you do this test and it confirms it and it gives you positive results, you have to visit the hospital for you to do other HIV tests using blood. Okay, so for a full video concerning how to use the Quick self-test, watch our next videos. So this one is done by the patient himself at his leisure, either at home, in the bedroom, with or without his partner. 2, now I'm going to talk about the 3 HIV tests which we commonly do in all health facilities. These tests are always antibody sensitive, meaning they identify the presence of antibodies in the blood of an individual. That's to say, if you have an HIV infection, your body starts producing antibodies against the HIV virus. Therefore, those tests test the presence of the antibody in your bloodstream. So, indicating positive, it means you have HIV, you have HIV virus. If they are negative, it means you're HIV negative. So, number 1, I'll begin with data mine. This is the commonly used strip for screening HIV. I think if you can look clear, that is how it looks. I believe most of us have used it. And as you can see, the results for this person were HIV negative, meaning he is safe. It is basically used for screening. But however, if it gives you positive HIV results, you have to do another test using another strip that we call start pack. So this is how start pack looks like. This is its packet, and if it also gives you HIV positive results similar to the determined strip, then shall confirm you being HIV positive. And immediately, the health worker attending to you will refer you for HIV care services, which include treatment and other investigations, for example, CD4 count and others. But however, if this result start pack gives you negative and the first determined strip gave you positive, then we shall do another test that we call SD bioline. That one is a tie breaker. So if it gives you positive results, then our results will be inconclusive, and we shall repeat the test after 2 weeks. And if we repeat the test after 2 weeks and we confirm positive results, we shall declare HIV positive and shall deliberately initiate you on treatment with ARVs. So that's the second group of HIV tests. Now the third group of HIV tests, which is rarely used by clients, but it's commonly used by we health workers, is the test we call HIV PCR test. It's one of the most sensitive tests and the most perfect test worldwide. It works by testing the presence of HIV RNA in blood. But however, remember, it is very costly. Due to the high cost of HIV PCR, it's therefore only and only a licensed health worker who recommends and requests for the test to be done. And you mainly do it in special groups. For example, breastfeeding children or children born to HIV positive mothers. And also in scenarios where the antibody test strips have failed to give us confirmatory results. But remember, for everyone who turns HIV positive should be initiated on ARVs in order to live a quality positive living. That comes to the end of our video, and see you in the next video when we talk about ARVs. Bye-bye.